Hello, everyone. Welcome to the Healthcare Payment Learning in Action Network 10th anniversary virtual event as we begin celebrating a decade of advancing value-based care. For those who I haven't met previously, my name is Dr. Judy Zerzan-Thul, and I'm the Chief Medical Officer for the Washington State Healthcare Authority. I serve as one of the co-chairs on the LAN alongside Dr. Alice Chen of Centene, Dr. Mark McClellan from the Duke Margolis Institute of Health Policy, and Andy Slavitt of Town Hall Ventures. It's a pleasure to be here with you today to celebrate this landmark event. Whether you've been a part of this work from the beginning or are joining us for the first time, we're glad you're here. We have a lot in store today as we progress through our agenda. To help get you a sense of today's event, here's a quick look at what's ahead. First, we're going to start with pre-recorded welcome remarks from CMS Administrator Dr. Mehmet and Steph Carlton, Chief of Staff and Deputy Administrator, along with the CMMI Director, Abe Sutton. We'll then transition into our panel of former CMMI directors to hear their reflections on the growth and the evolution of value-based care over the last 10 years and their forecast of future trends. Next, we'll hear updates on the 4 HPC-LAN work groups. There will be a preview of the new evidence-based prevention continuum from the evidence-based prevention work group, which is going to be published on the LAN website later today. Following the workgroup updates, we'll hear from Danielle Lloyd from AHIP with a presentation on the latest APM measurement effort results, followed by a panel discussion featuring leaders across health plan lines of business. Finally, we'll conclude the virtual event with information on how you can receive the latest updates from the LAN and stay connected. We encourage you to stay engaged with the LAN as we continue to drive the movement towards value-based care together. Please note, the Q&A feature will be available during this event. However, we will not be answering live questions. Instead, we'll address them post-event. So with that, up first, we have a couple of people who need no introduction. While Dr. Oz and Steph Carlton can't be with us live today, they were kind enough to record a brief welcome to kick things off. With that, let's go to the video.
Hello, welcome to the Healthcare Payment Learning and Action Networks, the so-called LAN, as you say it, 10th anniversary event. I'm here with Steph Carlton, Chief of Staff and Deputy Administrator at CMS. It's a pleasure for us to be able to join all of you virtually today as we celebrate the LAN's decade of advancing and enhancing value-based care.
Coming together for this 10th anniversary of the LAN, incredible power of public-private partnerships to turn a vision into actionable and measurable progress, accelerating the adoption of value-based care. The LAN's focus on enabling coordinated healthcare to achieve better outcomes and affordability for patients is very much aligned with CMS's vision. At CMS, the patient is our #1 priority, our #1 stakeholder. Everything we do is centered around the patient's well-being. In fact, we've designed our strategic goals around one simple premise: that great societies protect their most vulnerable.
We are doing that by making America healthy again through initiatives like our Rural Health Transformation Program, designed to unleash better health across all 50 states. We're crushing fraud, waste, and abuse by making sure our Medicaid and Medicare programs are no longer being overrun by fraudulent activity. We're also demanding outcomes for beneficiaries through launching a health technology ecosystem and modernizing claims processing systems. Unleashing affordability is something we're all passionate about through negotiating historic deals to lower prescription drug costs. And this, my friends, is just a sampling. We know there's still so much more to do, but we can't do it all alone. We are eager to work in partnership with the LAN. And I'm happy to say that across the public and private sectors, we're united in our goal of creating a better healthcare system and ensuring better health for all Americans. For the past 10 years, the LAN has shown that collaboration, innovation, and accountability are essential for building a healthier, more sustainable healthcare system.
Thank you to everyone for your engagement and dedication to this effort. And as we recognize the achievements of the past 10 years, we look forward to celebrating the next decade of advancing value-based care through the LAN. Congratulations.
Thank you to Dr. Oz and Steph for those remarks. Now, to build on that foundation, I'm pleased to transition to our next speaker, Abe Sutton, Director of the CMS Innovation Center. While Abe also cannot be with us live today, he too recorded remarks for this celebratory occasion to share his perspective on where things are headed and what it means in practice.
Welcome, and thank you for joining us today. I'm thrilled to celebrate the LAN's 10th anniversary. As Dr. Oz referenced, the LAN has proven the incredible power of public-private partnerships and our ability to drive change when we collaborate. The LAN's expanding community reflects growing enthusiasm and influence, showcasing the importance of collaboration in shaping the future of healthcare. The remarkable growth of the LAN to over 10,000 members, including payers, providers, policymakers, and advocacy groups, demonstrates how the LAN's network harnesses the collective strengths of the public and private sectors to drive accountable care and advance payment model adoption. The LAN's influence has been significant over the last decade. The LAN APM framework, now adopted by over 17 states and major organizations, including TRICARE, sets a unified industry standard, making it easier for both public and private entities to align on accountable care goals and practices. Regular publication of roadmaps and measurement reports facilitates transparent benchmarking, empowering stakeholders from all sectors to track progress and adopt best practices more quickly and effectively. Ongoing refinement of the LAN's workgroups and organizational structures ensures that the initiative remains responsive and scalable, positioning us to meet the evolving needs of the healthcare industry, stakeholders, and help sustain momentum for future progress for the betterment of patients and providers. Looking ahead, we are excited that the formation of the 4 LAN workgroups will continue to drive innovation align with the Innovation Center's strategic pillars. First, promoting evidence-based prevention. Second, empowering patients to achieve their health goals. And third, driving choice and competition in healthcare markets, all in order to make America healthy again. I would like to personally thank each of you for taking the time to attend this event. Your time is valuable, and your partnership and support are what drives this work forward. I also want to extend my gratitude to every facilitator and panelist for sharing their expertise in our panel discussions and for championing accountable care within their organizations. Thank you to everyone who played a part in making this event one to remember, and as we celebrate a decade of achievement in advancing accountable care through the LAN. Thank you all again, and I hope you enjoy what we have planned for this afternoon. It's going to be fun.
Thank you to Abe for your insights and setting the stage for a wonderful event.